Secret COVID-19 study in Italy? Calculations provided by Merler were up to 1,200 victims per day with RT of 1.25, which translates to up to 1,200 to 1,300 victims a day. So far since February 2020, Merler has gotten the numbers right. A committee of 24 experts advising the Italian government on the pandemic was decisive and reported to curb the reopening. The calculations provided by Merler were up to 1,200 victims per day with RT of 1.25. RT is the measure of how quickly the virus is spreading. So Palazzo Chigi, also known as Chigi Palace, which is the seat of the Council of Ministers and the official residence of the Prime Minister of Italy, rejected the idea to free all. So far since February 2020, Merler has gotten the numbers right. The study, which was never made public by the government, but which publication Il Corriere could analyze and make available on April 16 at the Comitato Tecnico Scientifico CTS, a committee of 24 experts advising the Italian government on the pandemic, was decisive and reported at Palazzo Chigi to curb the reopening, considering it too risky as requested by the leader of the Lega Party, Matteo Salvini. The latest RT detected on symptomatic cases, referring to the period between March 31 and April 13, is 0.81. This is the starting point. In the projections there are only calculations, nothing about what to reopen and what not. These are choices that belong to the government led by Italy Prime Minister Mario Draghi. There are hypotheses on the table, including if RT returns to 1, which is more than likely following the reopening between now and July 15. According to Merler's forecasts, we should continue to deal with about 200-300 deaths a day. If it rises to 1.1, the risk is a steady increase in deaths up to 600 per day in mid-July, 300 as of June 24. The disaster was 1.25, up to 1,200 to 1,300 victims a day. Of course, all of this applies without additional restrictions. To simplify, in a scenario of free all, another simulation illustrated by Merler shows that if the reboot had been postponed to May 12, the daily deaths could have been half at 100. The reason? Delaying the restart by 2 weeks would have meant opening with a number of daily cases much lower than the current one. It is the so-called incidence, which inevitably brings with it a percentage of deaths. The latest CTS report, updated on April 18, counts 157 cases per week for every 100,000 inhabitants. In order for the epidemic to be under control, we need to reach 50. Without reopening, which affects the rise in the infection curve, in 15 days we could have gone down quite a bit. In this case, always with a RT of 1, that is, with an infected who infects another, we would have had a lower starting number of infections with the obvious consequence of fewer deaths in prospect. Also on July 15, with the RT of 1.1, there would have been 200. While with the RT of 1.25 there would have been several hundred anyway. Now there is a bit of margin. But it is minimal. We cannot make the RT rise above 1, and we already started from 0.81. Therefore, the treasury we have, according to Merler's analysis, is 0.2. And we have already played with it for a while, as shown by the slides shown at the CTS with the restart of school in attendance. Certainly on the basis of Merler's calculations, the alternative, which would not have displeased some members of the CTS, could have been to reopen in May with a lower incidence. The fear is that being high, the contagion curve could grow back quickly, forcing new closures. But here political choices came into play, the calculated risk invoked by Mario Draghi as it were. Merler's accounts take into reason the lowering of the lethality of the virus induced by vaccinations. Thanks to vaccines, COVID is already killing less, and at some point, it will become comparable to a seasonal flu, that is, going from 11 deaths out of 1,000 infected, to 1. A first date hypothesized by Italy think tank Institute for International Political Studies ISPI in this sense was June 25. But everything is linked to the pace at which the vaccination campaign is proceeding and, above all, to those who are immunized. The frail must first be protected. Palazzo Chigi, along with Military General Francesco Figliuolo, expects to accelerate further on vaccinations, reaching to protect 80% of the frail by May 25. And the reopening will be gradual. Beyond the accounts, the awareness of the CTS is that much will now depend on individual behaviors. Otherwise all that remains is to close down. #rebuilding travel